Lots of folks have had a lot of questions about these air quality alerts and what they actually mean for all of us. And joining me live this morning to answer some of those questions is pulmonologist and vice president of clinical operations at Virtua Health, Dr. Sztejman. Dr. Sztejman, thank you so much for joining us this morning. We appreciate having you.
Good morning, Natasha. Thanks for having me.
Well, let's start with the biggest concerns right now for people with all of this smoke that we're inhaling. Who is most at risk, and should everyone be concerned?
So seeing what our levels are today, I think it's really important that everyone be concerned, specifically those individuals with underlying cardio and pulmonary disease. And we can't forget the little children going out into this weather. So it's really important that we take heed of the notices that are out there and we stay home, keep our windows closed. In addition to, when we're driving, use that recirculation button so we don't bring in that thick air into the cars.
Yeah, that's a really good point there. Now, what kinds of health impacts can this kind of air quality and haze have on any of us, even if you don't have any pre-existing conditions? What symptoms should you be looking out for?
As many of us have been outside, and they can feel that thick, heavy air as they breathe in, and as it comes into your lungs and in your eyes, you can start having itchy eyes, sore throat. Many of our patients are starting to complain of some chest tightness, especially those with asthma and COPD. Other things that you worry about is really the length of exposure. You really don't want to be outside, and unfortunately, the cloth masks really don't help much. And it's better than nothing, but truly an N95 or a KN95 if you have to be outside. So it's important that everybody try to stay in, keep their windows closed.
So those thicker masks, those KN95s and N95s are the best masks. So what can people do to protect their health at this point? I mean, if you do have to be out and about outside, if you have to be out for any length of time.
So if you're out for any length of time, it's really important to wear a KN95 or an N95. And you also want to protect your eyes, as well as, your nose will be protected with the mask. But really try to limit that time, be predictive of how long you're going to be out there. Because the more exposure you have to that thick smoke could cause problems with your lungs.
Now, Dr. Sztejman, just in your career there at Virtua, and even possibly before, have you seen anything like this?
Not for this time period. Typically, the smoke injuries that we've seen in burn centers and elsewhere is just an acute injury for a short period of time. But having such a long period of time, if you think when this started, Thursday into Friday of last week, it's almost been a week now. We had some local fires here in Medford and Bass River, and we started to get some calls over the weekend, and really this Monday into Tuesday and this morning, we have already 40 to 50 calls into our offices complaining of chest tightness and just not feeling well. We haven't really seen much in our emergency departments, but our urgent cares are starting to pick up as well. So if people can stay inside and really protect themselves, that'd be best.
All right, great advice, Dr. Sztejman. Thank you so much for being with us this morning and bringing us your perspective. We do appreciate it.
Thank you for having me.